In this lesson, you will learn how to diagnose a substance use disorder using DSM-5 criteria. By using standardized metrics, we can avoid using our individual beliefs of what might constitute a problem. There are 11 criteria in total that help providers make unbiased determinations. Substance use disorders can be classified as mild, moderate, or severe, depending on the number of criteria met. Before we begin outlining the criteria, take a moment to brainstorm some behaviors or symptoms that you think would signify disordered use. Just use your best judgment to guess what characteristics would distinguish disordered use from recreational use. As we go through the 11 criteria now, note any similarities with your list. Use is in larger amounts over a longer period of time than is intended. An example is the person who says that they'll have one drink at the bar and ends up staying all night, maybe has 5 drinks. Or a person who plans to use 1 line of cocaine on a Friday evening and instead uses all weekend. The next criteria is increased time spent using the substance. This may mean increased time obtaining, using, and recovering from the substance. Next, we have unsuccessful attempts to cut back or control use. Loss of control is a defining factor of addiction. We often hear people say that they will limit their substance use, and there's a wish that they could control the use, but that's just it. The person's unable to have 1 drink or 1 line of cocaine in a sustained way. Inevitably, it returns to larger amounts. It's important to say here, too, that this is not a matter of willpower. This is not a weakness on the individual's part. Next, we have activities given up. We can think of this intuitively. If a person is spending more time using and recovering from substances, then inevitably other activities are given up. This might mean less time working out, spending time with friends and family, or any previously enjoyed activity. Next, we have failure to fulfill major role obligations. This is referring to whatever the person's role may be, a student, a professional, a parent. The person's unable to meet the expectations of their role due to their substance use. Next, we have continued use despite social and interpersonal problems. These might be relationships with colleagues, partners, or family members. We often hear this as a person describing a family member who's repeatedly expressing concern about the substance use. It might refer to arguments when the person's intoxicated, or in very disruptive ways, like stealing, financial disruption, or even legal problems. Next is continued use despite negative physical or psychological consequences. An example would be a person who's in a primary care setting and has been told that their hypertension or diabetes could be better controlled if they were to stop drinking. The person appreciates this, but continues to use despite knowing it. Similarly, we might see a patient present with symptoms of depression, and they may be well aware that the substance use exacerbates the mood symptoms, however, they continue to use. Next, we have recurrent use and hazardous situations. Some examples would be driving or boating while intoxicated. It might be someone who's a roofer and is working at high heights while intoxicated. And then we have craving. Craving is new to the DSM-5. Craving refers to a person being preoccupied with using the substance so that they cannot think of anything else until they have obtained and used the substance. Then we have tolerance, which refers to a person needing to use more of a substance to achieve the same effect. Where 1 drink may have had them feel the effect of the alcohol, now they need 3 to experience the same level of intoxication. Finally, we have withdrawal. Along with tolerance, withdrawal speaks to the physiologic dependence a person develops to repeated substance use. The specific withdrawal syndrome, including the onset and duration, will depend on the actual substance used. It's important to note here that neither tolerance nor withdrawal are used as criteria for a substance use disorder if the person is being prescribed a medication for which we would anticipate they're developing physiologic dependence, like with opioids or benzodiazepines. Without other criteria being met, a person who is prescribed opioids that has tolerance and withdrawal symptoms when the substance is removed would not meet criteria for a substance use disorder. Now that we've covered the 11 criteria, let's pause for a quick comprehension check. True or false? Frequency and amount of use factors into a substance use disorder diagnosis. False. Quantity and frequency of use are not part of the diagnosis for substance use disorders. For example, someone that drinks daily may still drink within the national drinking guidelines and may be considered at low risk for developing a substance use disorder. The point being, frequency of use does not determine that someone has a substance use disorder. How much someone is using or how often someone uses is not factored into diagnosis, but it will be important to understand the pattern of use to help the patient create a treatment plan. One way to keep track of the 11 different criteria is to group them into 3 categories called the 3 C's of addiction. These are loss of control, continued use despite negative consequences, and cravings. Within the cravings category, we place the 2 other physiologic signs of tolerance and withdrawal. These are the 3 physical signs that the body has adapted to the substance use. So how many criteria are needed to receive a diagnosis of a substance use disorder? If you had to guess, how many criteria would a patient need to meet to be diagnosed with a mild substance use disorder? Since the DSM-5 was published in 2013, only 2 criteria are needed to meet criteria for a mild substance use disorder. If someone meets 4 or 5 criteria, that's considered a moderate substance use disorder, and 6 or more reported criteria signify a severe disorder. Diagnosis is a critical skill and a key step in the addiction treatment process. We hope you take advantage of the resources in this course, from handouts to quizzes to the simulated case, to practice diagnosing substance use disorders. In future lessons, you will learn how to conduct a full assessment in order to formulate a treatment plan.